Why do dentists take x-rays? We need x-rays to be able to see under the surface. So that's a very common question from our patients. Usually they ask, why do you need x-rays? Because to them, it's radiation and extra cost. But first of all, keep in mind that the x-rays that the dentists take usually should not be very expensive, like they cost about $40 or $50 here in Australia. But obviously at the time of taking this video, I don't know how much it's gonna go up, but comparatively, it's not a very expensive thing that people think is, like CT scans or MRIs. That's one thing. Second, radiation in the x-rays, dental x-rays, it's so small that it's almost negligible. And I understand that it's still radiation, but you have to remember there is radiation in everything, from a banana to taking a trip with a plane from Melbourne to Sydney. Small, short flight. There's always radiation. When you sit in a car, there is radiation. So unfortunately, we are always exposed to a bit of radiation. The amount of this radiation in the x-rays, dental x-rays, is very small, but necessary to be able to find out issues underneath the surface. Remember, when a dentist looks inside the mouth, they're looking at the tooth from the upper surface. They see the tongue area and the cheek area. They cannot see between the teeth. They cannot see under the surface. There are many things can be going on underneath. What are some of the things that the dentist will find out by taking dental x-rays? The most important reason a dentist will take dental x-rays is to check interproximal areas, the areas that are between two teeth. Those are the areas that usually food gets stuck between the teeth and people do not floss as much as they should. If we take routine x-rays and we find any issues, small cavities, we can either have an eye on it, give you medication like tooth mousse that would reverse a small cavity to use at home, or we might need to start a filling, but at least we do it when it is small rather than it getting really huge, hurting you, and being too late to save that tooth. Another reason a dentist will take a dental x-ray is to check underneath the surface around the roots of the teeth. Roots are inside the bone, so we're going to check and make sure the roots are okay, the bone around the root is healthy and enough, it's not shrinking, it's not reducing in size, there's no infection inside that bone or around the roots that is silent and not hurting you. These are the things that we check with dental x-rays and we cannot see when we look in the mouth. For children, we take x-rays to make sure that their adult teeth are coming out. They have all of their adult teeth. There is enough space for the adult teeth to come out, and we basically monitor their growth. Dental x-rays also help the dentist prepare for your treatment. Whether it's a filling or it's removing a wisdom tooth, it helps us see how the roots are, how the curvature of them is, if the cavity is big or large, and then we can plan and give you the risks that are associated with that treatment. Let's say there's a huge cavity that you don't know about, but we find it with x-rays. We let you know to have that filling done sooner rather than later, because if you do it sooner, you will avoid treatments like root canal or completely losing that tooth. But we do need that x-ray to be able to inform you about all of this. Dentists are recommended to stick to a LARA, which is as low as reasonably achievable, which means we don't take x-rays unnecessarily. We don't take x-rays every month from you. That's not needed. But we would have to take x-rays regularly. And by regularly, I mean once a year, once every year and a half, the latest, to be able to monitor the changes in your mouth and catch things on time. Not only does it have any disadvantages for you, but also it helps us prevent big cavities, infections, or find any infection, cysts, tumors while they're small and treatable, rather than leaving something to blow up and then we find out when you're already in pain and it might be too late. Thanks for watching. If you like this video, don't forget to like and subscribe and comment below if you had any questions. I'll see you in the next one.